welcome everyone. My name is Kim Barnes, and I'm the Director of Student Affairs for our Phoenix campus for the College of Public Health. And thank you so much for joining today's session. This is the Spring 2023 Virtual MPH Internship Conference live student highlight event. We're so excited that all of you are here with us today, including current students, faculty, preceptors, prospective students. And we would like to take a moment to do the land acknowledgement, to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. So as you may know, our Master of Public Health students from Tucson, Phoenix, and the online MPH programs all conduct internship experiences in communities around the world. The internship experience serves as an integral part of the MPH degree curriculum, in which our students are able to utilize their academic knowledge from the classroom in real-world practical situations among professionals in the public health workforce. These hands-on, culminating experiences benefit students and organizations alike. We are so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. This virtual internship conference student highlight event is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, student, and global communities. Coming up next, you're going to get to hear from 4 of our MPH students in Spring 2023 presenters, Elizabeth Mangone, Chad Peterson, Ryann and Sam Sneed, and learn more about their amazing internship experiences. After our student panel, we'll provide some additional details about the conference and how to view our student presentations. So welcome everyone. We're so happy to have our student panelists today, Elizabeth Mangone, Chad Peterson, Ryann and Sam Sneed. They're representing all 3 of our campuses. So please allow me to introduce you to them by way of their brief bios. Following that introduction, we have some prepared questions for our panelists, and then we're going to open it up to the audience for questions. So Lizzie is an MD MPH student based in Phoenix. She's completing the clinical leadership concentration. She's graduating this spring and will be starting her OBGYN residency in the summer at the University of Arizona College of Medicine, Phoenix. Her internship is titled Treatment Completion with 3-Dose Series of Benzathine Penicillin among people diagnosed with late, latent, and unknown duration syphilis with Maricopa County in Arizona. Her public health interests include syphilis, maternal health, and OBGYN surgical outcomes. Chad is pursuing his MPH with a concentration in epidemiology and is set to graduate this summer. As a kid growing up with asthma, but heavily involved in outdoor sports, Chad became interested in how an individual's dynamic health outcome can be heavily dependent on the opportunities provided by their community. To understand this dimension of health more thoroughly, Chad jumped at the opportunity to join the mental health work group at Graham County to execute his project, which is called Social Vulnerability Determinants of Mental Health. Being part of a larger resource mapping initiative has given him so much experience with community health, which he's excited to apply in his career after graduation. Ryann is finishing the MPH in Behavioral Health Promotion this May and conducting an internship titled Improvement of Substance Use Disorder, Opioid Use Disorder Messaging in Santa Cruz County, Arizona. Ryann earned a Bachelor's of Science in Public Health from the University of Arizona in 2015 and currently works as a Domestic and Sexual Violence Program Supervisor at Mariposa Community Health Center. Ryann's interests include rural health, Hispanic population, teens, substance use disorder, sexual domestic violence, and peer services. And last but certainly not least, only alphabetically, Sam Sneed is an MPH student in Environmental and Occupational Health in the Industrial Hygiene track and will graduate in May of 2023 and previously completed the Bachelor of Science in Public Health in May 2021. Over the summer of 2022, Sam completed an internship titled An Introduction to Safety and Industrial Hygiene at Central Arizona Project. Sam currently works full-time with the University of Arizona Cancer Center as a clinical research coordinator to help enroll patients with cancer into clinical trials so that they can receive cancer treatments that are yet to be FDA approved. Sam is highly passionate about public health research focused on preventing and treating cancer and hopes to combine both interests in the future as a physician scientist. Oh my goodness. Talk about already in that, just those introductions, the breadth of projects and expertise that you all have developed in the MPH program. It's so amazing for us as student affairs professionals to see this, but also as MPH alum and Samantha, Mariah, and I are all MPH alums, to hear about the amazing work that you're doing and to hear a little bit about the careers you're going to have. We are so honored to be a part of that journey for each of you, and so excited that you're able to give back to us in this Student Highlight event. So now for some questions. We're going to start with an easy one. It's a little like elevator pitch about, can you briefly describe your internship experience? Just in like a minute from each of you. I know I gave some context to your internship, but just directly from each of you, 1 minute about what your internship was. And I'm going to go ahead and say, let's start with Chad.
Hi, everyone. My internship experience was with Graham County Mental Health Work Group. So I worked with a database that's public domain, Social Vulnerability Index, which ranks every county and even subtracts of the county across the whole nation for key vulnerabilities, particularly socioeconomic and disabilities. And I applied this to mental health. So a lot of the social vulnerabilities that were listed in the database were closely aligned to the CDC's list of adverse childhood events. And then this was part of a larger resource mapping event for Graham County, in which they were trying to figure out what the needs of their community were for mental health, also the resources that were available. So hopefully this project going forward, a lot of the data that I collected and graphs can be continued on as almost sort of a surveillance to kind of see how, as different interventions are made to the community, or also different services are brought in, how that impacts a lot of these vulnerabilities. It also ranked, because it was ranked across the whole country, you could compare the vulnerabilities from this data set to any other even subtracts within the counties across the nation. So I compared it to other counties within Arizona, as well as the national and state average.
Great. Thank you, Chad. Lizzie.
Hi, everyone. Thanks so much for joining. My internship experience was at the Maricopa County Department of Public Health in the STD department. And nationwide and in Maricopa County and in Arizona, syphilis is currently undergoing a public health epidemic, and the rates are going up every year. And so we wanted to investigate treatment completion with 3 doses of benzathine penicillin, which is the recommended treatment for latent and unknown duration syphilis. And we wanted to create this benchmark to determine what the rate is for syphilis treatment in Maricopa County, to then inform future studies that can help us determine where syphilis is being administered, because there's issues with administration. My role in the internship was conducting like a background lit review. I did data extraction after learning SAS coding software, and then created a manuscript that was recently published in the Journal of Sexually Transmitted Diseases. And we presented the research at the the American Public Health Association conference in Boston.
That is amazing. I was really hoping I got the benzathine right. I was like, I'm not going to say this one right. So I think I got it. Okay, good. Ryann, if you could share with us.
Yeah, hi, everyone. My name is Ryann Quick, and my internship was at Mariposa Community Health Center. I'm an online student, so I did my internship remotely. And what I was focusing on was creating a centralized hub of information through a website for Santa Cruz County residents and agencies to use to access information, resources, and tips about substance use and behavioral health services in Santa Cruz County. So by working with the Santa Cruz County Overcoming Substance Addiction Consortium, I was able to get all the resources in the county together, put it into a website that if you're a parent and you want to learn more about fentanyl and what the street names are here in Nogales, you can get that information. If you're looking for rehab and detox, you have to go to Tucson, but I have all that information in one spot. If you want to get access to Narcan, etc., I was focusing on putting all that information together, so that way people can have more access.
That's amazing. Thank you. And Sam.
Hello, everyone. I completed my internship at Central Arizona Project. For those of you who don't know, here in Arizona, we get some of our water from Central Arizona Project. What the company does is they provide water from the Colorado River, and it's transported in a canal system. But my role in the internship was to really be heavily involved with the health and safety team. And we were implementing ways of how we can keep employees safe, whether that's by analyzing and helping to ensure that they're not exposed to high noises or harmful chemicals. And this is as a way to protect, obviously, their health so that they can go back home safe and healthy. But then also at the same time, while doing so, we help to ensure that the company keeps on running and that Arizonans throughout the state can get water.
Thank you all so much. So I'm hearing we have syphilis expertise, we have social vulnerability, substance use, and water. Thank you, Sam. We do enjoy our faucets working and water provided. If anybody can just see how amazing those different experiences are and how they really tie into different competencies in public health. We have assurance, we have policy development, we have research, assessment. So all of the different areas of public health, just right there in 4 students are being addressed. Now imagine all of the presentations that are linked on our webpage and all of the amazing work all of our other students have done as well. So we'll tell you more about that later, but I just have to plug that because it's so cool to hear about all of your different projects. So I see some current students in our space, current non-graduating students, and for us as well, if you all could share a little bit about how you found your internship, both like where you learned about it and then how you got it. That is always really helpful for students to know. And anyone can start.
I'll start. So actually, initially when I was going to start, I was going to go with another agency that was focusing on homelessness. And I was going through that process and they realized that they weren't ready for an intern. So I started to panic. And that's when I started talking to Dr. Gerard, and she gave me some really good guidance. And I just used my network. I used to work at Mariposa Community Health Center a few years ago. So I reached out to my network and I said, hey, this is what I can offer. This is what I can do. And I was able to jump in and fill in this need for creating that website. And it was a super amazing experience. And some recommendations I give to people is use your network. If you want to try something new, great, go for it. But you can always go back to the communities that you're from and work that way.
You can also develop a new network while you're here by attending seminars and meeting faculty and other students. But yes, network is one of our top pieces of advice. Anyone else want to jump in?
I'll echo that in saying that I thought I had to have this like predefined, go on the website, pick an internship that somebody had already created for me. And none were really speaking to me. I was thinking like I'd go into OBGYN or infectious diseases for my medical specialty. And so I reached out to my faculty advisor, Dr. Campus Alcohol, and he put me in contact with Stephanie Kreis at the Maricopa County Department of Public Health. And just through multiple conversations with her and talking to her team, we found an unmet need and what I could start researching for them. And it really it did create a new network for me and was a great way to start networking.
Awesome.
I guess I got a little bit lucky with mine, but I found mine off the job board or the internship board on D2L. And then it kind of worked out just before school started. I learned about this database, the SVI database, and was kind of playing around with that and realized that it could be tied into resource mapping. But even I found I got another internship started after this one, and just going on website and looking for organizations that you're interested in, reaching out to them. I found an organization on the East Coast that I'm now working with Lyme disease assessment survey. So don't be afraid to, if there's organizations you're interested in and they don't necessarily list something on the website, emailing or calling them up and reaching out to them, see if they've got any ideas.
The power of the cold call or cold email, usually, right? There's power there for sure. We have, just like Lizzie pointed out too, there's gaps and there's needs. And when they have a student come to them and say, hey, I'm looking for something, I'm sure you need something, where can we dovetail? That's where the magic of the internship happens. Sam.
I actually got very lucky. I didn't do a lot of the heavy work of searching. It was actually professors were emailing out to the students in the department. They were emailing internship opportunities. And I remember that I would pin them to my email. And then I had a couple already that I was interested in. But that's really how I found it, and I applied and I got it.
Success. We love those faculty sharing those opportunities. Sean, you have a question.
Oh, yeah, just similar comment. I was aware that some wonderful research was being done at the Arizona Alzheimer's Consortium in Phoenix. So it was just a matter of emailing them, and turns out that, they had a database that I was able to use.
Yes, exactly. When I did my MPH, it was a cold email. I said, this seems like a great project. Can I help you do something? And they said yes. So there's definitely power there in the network, but researching, and I didn't hear anybody say it today, but who started early in their researching internship processes? I see a couple hands. We always recommend starting early because sometimes things fall through. Like Ryan, you mentioned, or you're nervous about it, or it's not a great fit. So we definitely recommend starting this process early so that you have some time to make sure it's the right fit for you. That's great. Thank you all.
Starting early is great too. I actually got mine started a year early. I thought that I needed to get it going on the internship thing right away. And it gave me a great opportunity to go to an event that they had last April and just learn a lot more about public health and how Graham County brings together coalitions that I would have missed out on if I had waited.
Yes, and I think that that's a really good point. So given we have Ryan and Chad here and other online faculty and students as well, wherever, you're going to hear a lot about things happening in Tucson, and certainly our Phoenix students feel that as well. Make sure you're investing in public health where you live and where you want to work. Whatever county that is, find the coalitions, find the public health association chapters, because that's the network that you can build best, and find the opportunities, just like Chad mentioned. Learn a little bit more about those things early on. That's great. So I'd love to hear, did anyone have like a really unique experience at their internship, something unexpected? And when I say unique, it doesn't have to be positively unique. So something unexpected that might have happened, and how you celebrated that or how you dealt with it if it was a challenge.
I will start. So my unique experience at my internship, when I started, I had done all my internship prep work. I thought I was going in to do a literature review and then analyze data, but I guess the analyze data part was a little vague and I didn't fully understand what that meant. And so I showed up on day one and started working with Jonathan Bell, who is an awesome mentor. And he is a coding epidemiologist. He codes every day. And so I had to learn SAS and learn how to code. And I spent the first week, took a month off of med school to do my internship. And I learned how to code and was able to apply that. And I felt like this is something I never thought I'd do in a million years, but it was a really great opportunity. And I was really proud of myself for picking it up and being able to use it to extract data, manipulate data, and figure out what we've needed to for the project.
That's so great. And also really recognizing that sometimes we're not prepared as prepared as we thought, but having that mentorship and somebody at an internship site who you feel comfortable is going to help lead you is something to really identify for yourself, because there will be new things you're going to learn. That's part of the gig, right? Chad, I see you unmuted.
Oh yeah, I was just trying to decide one interesting aspect of my project that was kind of difficult to get over along those lines of coding and learning new software. I'd never done sort of spatial analysis before. And so part of my project, I wanted to map out the vulnerability densities within Graham County. And I got to learn how to use Tableau. I had the 2-week trial to try and get it for free. So over that week, 2 weeks, I was on YouTube a lot trying to figure out all this stuff. But it was really rewarding at the end to be able to come up with pretty density maps and whatnot for Graham County. And another maybe a little bit more exciting experience that I had is getting started early last April. I got to be part of a coalition stakeholder meeting, or not coalition, just a stakeholder meeting. So Graham County and trying to find out what resources were available within the county and get those mapped out. We gathered all different medical professionals, from psychologists and even education. So not just medical, but different stakeholders in the community that could possibly be related with mental health, and trying to map out how, when somebody is having a mental health crisis, or if they are trying to find more resources, or we came up with all these different scenarios, how are those people given the resources they need? If the educators in the school system. So they have a crisis management plan. How do they reach out to get those people services if the police officer pulls someone over for driving under the influence or something like that, or they're causing a scene? How do those people, do they get connected to other therapists and medical professionals in that way, or are they just an ambulance called for them, or are they just taken off to jail? So we came up with all these different scenarios, and then we're able to walk through them, break up into small groups and walk through them with different stakeholders. And that was a really cool experience. And then we sent out a survey before the meeting, and so compiling all the results from that survey into more visual graphs and tables and stuff was a pretty cool experience.
That's really great. I will say, having served on a coalition group for a long time, we love students. We love students coming in. People love teaching about public health and getting students to see it in action, even if you're not an intern. So if those opportunities exist for you, take advantage of them. Sam and Ryan, I'd love to hear from you both.
I guess I can go. I think going into this internship, I went very open-minded. I wasn't expecting something specific, but the most exciting parts of it were, for one, there was one day that I got to go on a helicopter ride because we were measuring, ensuring that employees weren't being exposed to loud noises on the helicopter ride. So that was pretty amazing. I'd never been on one. And then I also got to go inside of the pipes. So it's pretty impressive going on one of the pipes where some of our water goes through. So I would have never thought I would have been 70 feet underground, but I was. So that was pretty exciting.
That's really exciting. I can tell you, as a kid, we used to walk in our local canal and go inside the pipes too. So that's probably not great, but exciting. The helicopter ride sounds way better than the pipe crawling in my mind. But Ryan.
Well, I was doing mine through Zoom, so no helicopter rides for me. But I would say I've never made a website before, so don't underestimate it. It's a lot. But I think for me, it was really about managing relationships. So there's over 20 different organizations within this consortium, and I had to put all their perspectives into one place. So managing that communication about harm reduction, prevention, abstinence, law enforcement perspective versus behavioral health versus peer support. So managing those relationships and really understanding what each agency does, how they serve the community, and how I can package that together so that the user doesn't see divisions, but sees unity within this consortium. So that was my experience.
The power of managing the web. It sounds like you and Chad had some similar experiences there. And it's challenging, but also really amazing when it comes together, right? So I'd love to hear a little bit about the skills. What skills and knowledge from your MPH curriculum did you find you most utilized during your internship? So rather than maybe the new things that you learned, what were the skills that you felt like you really brought to the table, in week one?
I can go ahead and get started on that one. When I went into the internship, I already had a year of experience working with one of the professors at the college. And a lot of the work that I was doing was, it was more on the environmental health side, but using techniques of an industrial hygienist, which was what the internship was about. So I feel like that experience, but also the coursework, specifically the ones required to enter classes for the emphasis, really prepared me for the internship, because I felt like I had a foundation of knowledge going in and I wasn't just like completely blanked out and didn't know what I was doing.
Yeah, that's particularly important. I think your concentration is very unique in that it is very specific. So EOH, industrial hygiene, right? And so you have very specific things that someone's going to expect you to be able to do in the field. And I'm really happy to hear you felt prepared for that. That's great. Lizzie, Chad, or Ryan, do you want to add to that?
Sure. Generally, the EPI 1, Epidemiology 573, was really helpful for just kind of learning what databases were available and being able to know that there is all this data that's just available literally to anybody who's willing to go out there and make a project with it. And also outlining the basis of my project was a descriptive study. So learning about descriptive studies and what kind of analyses are most useful for that. Then HPS 577. sociocultural aspects of public health was really important for learning how to kind of connect, especially in the mental health field. There's a lot of different variables that, I mean, before this program, I probably wouldn't have thought went hand in hand so much with health. And then we had a lot of discussions on there, which kind of introduced me to the CDC's adverse childhood events, which were kind of a big basis for the vulnerabilities that I picked. And then lastly, of course, the 2 biostats classes with learning about parametric and non-parametric significance tests and stuff like that.
What I'm hearing is don't underestimate the importance of those quantitative classes, especially for those concentrations where you're just going to take the A's, Epi A and Biostats A. Make sure you take good notes so you have those when you start your internship, right?
Definitely.
Yeah. Ryan or Lizzie, did you want to add to that question? Things you felt like you were bringing to the table?
Yeah, so for me, it was a combination of things. So I'm from Santa Cruz County, I'm from Rio Rico. So I know my community, and I used to work at Mariposa Community Health Center before and manage the medication assisted treatment program for opioid users. So I had all of that knowledge. But from the classes, one of the benefits is that majority of the classes will be pick the topics that we're going to be researching, doing lit reviews on, looking at theories and all these things. So I was trying to keep things consistent. In most of my classes, I was either talking about Hispanic health, rural health, substance use, trying to keep things within those themes, mental health. So when I was doing my internship, I was able to pool that information I've been doing in my classes. So when I had a class on public health communication, I was using those techniques that I was learning in that class and applying it to making flyers and stuff and things for the website.
That's really cool. I have a follow-up question for you. Did you know what content area you wanted to sort of pursue when you started the MPH?
Yeah, so just based on my experiences professionally, I knew I wanted to stay in like either like the mental health or substance use, vulnerable population type of area. So I tried to keep all of my assignments in that realm. So I didn't really like try to learn about like nutrition or diabetes or anything like that, just because I know that it wasn't gonna help me in the ways I'd want to, like professionally. So
I really like that idea of sort of being consistent with your research projects to build sort of your own portfolio of knowledge. I popcorned, so I did not do that, right? I did like 18 different things. And I think we have students who do that too and find their way. But if you are someone who has that really like, and this is just confirming your goal, what a great idea to have that consistency and really build that portfolio for yourself. That's really a great idea. Lizzie.
Yeah, mine was similar to Chad, where I had not as much quant as Chad did, but I think biostats and basic principles of epidemiology were helpful to just give me a framework going in to be able to analyze the data that we were seeing. And then the sociocultural and behavioral aspects of public health was really important, because when we ended up finding the rate of treatment completion, it was quite low. And so a framework to help think through like what could be contributing to this and why, and what can we do about it was really helpful. And I think I had been prepared for that because of my classes.
That's really great. It's also important to think about sort of the timing of which your course sequencing and what you hope to intern and how that dovetails for you. And that's what, we're all here to help you with that in student affairs, but that's an important consideration. So next question. So you brought skills, you learned new skills as we expected. So how do you think this internship experience that you completed is going to help you with the next phase of your career, either in the next 3 years, 5 years, 10 years, whatever point you want to talk about? What can you see it really having done for you that you're excited about and you really sort of makes you glad that you chose this experience? And anyone can start.
I can start with this one. I think this internship is extremely useful to my soon-to-be future career in a month when I start residency as an OBGYN. I think a couple of things. One, it was really helpful as a medical student. We learned all the stuff in books, like syphilis treatment is benzathine penicillin. And from this MPH internship, you learn that that's not the reality. Not everyone's getting this treatment. We have an epidemic, and there's a huge unmet need to find ways to test, screen, and treat people. And so I think in like as a provider now screening women who could pass syphilis onto their babies, being really cognizant of how are they going to reach treatment, and having a good network of referrals and collaborating with public health professionals to make sure that's possible. And then another aspect is conducting public health research is super interesting, and being able to treat patients on an individual basis, but then recognize the public health issues that are facing the community and kind of mirror those to provide care to more people, and research that can further policy and management changes.
And that's why we love when our MD students do MPH degrees right there.
They're
To your point, problem A and solution A, it is not often a straight line. Public health recognizes the wobbly road to get from A to A. And so, yeah, that's a really excellent point. Others, I'd love to hear from everybody on this question. So
I think it's really important going forward in public health to understand what data is available to you and how you can maximize it. One thing I've learned in this program is there are so many databases out there that have, I mean, it kind of seems like random data at times because it may not be collected for a specific purpose. But then learning how you can develop research questions about that and how you can use that available research in your community rather than having to create your own research. With this database, there's all the information is collected from the census. So it's pretty amazing that they're able to ask these questions basically for a lot of communities that maybe might not have the resources to be able to send out surveys on this scale or collect this data. So I think knowing how to utilize those databases to your strengths will be really important. On a lot of the applications I've been starting to apply for too, they want database management or some kind of experience working with databases that have like 10,000 records or more, which isn't something that I've worked with before. So being able to comfortably organize that data, and it's really satisfying too when you open up the Excel document and it's just all these numbers it's filled with. And once you're able to pull out graphs from that and kind of make sense with it and turn it into something useful is really rewarding. But I think to public health as a whole, it'll be really important to learn how to utilize these databases.
and we love our folks who can do that, right? Even us in student affairs, the folks who can make sense of the data are lovely. So that's great to hear, Chad. Sam and Ryan.
So I've already had a change happen because of this program and my internship. So I was offered a job at Mariposa Community Health Center where my internship's at. I'm in my office right now. And what I'm doing is I'm now the domestic and sexual violence program supervisor. So just this experience and being able to showcase like some of my skills and things I've been learning throughout the program has put me in a position to be a candidate for this job, and I got it, and it's been great. So I've already had that, and then just thinking like beyond, in public health, in the classes, we're thinking about theories, we're learning, we're reading, we're writing. It's all kind of like paper-based, like that's how I think of it in my brain. And reality is we work with people. So the internship gives us that opportunity to work with people and apply those other skills and really just learn from people's experiences and the needs of communities. So just trying to keep in my head, how is it as I move forward to balance like the academic side of public health and the research and also the people part of it. Like, how can we just get things done? How can we work with people and meet them where they're at? So I've had lots of great things come out of this.
Research, outreach, and service, right? Like 3 core tenets. So congratulations on the job. That's super exciting. And also really like what we love to see happen for students is they find the space to intern. And then when that job opens, they have spent a whole internship interviewing for those positions. And so it's really lovely when that happens. I'm very excited for you. That's great. Sam.
Similarly to Ryan, I think one of the big things that I learned through the experience, I was a safety and industrial hygiene intern. So that basically a big part of it is connecting with people, with the employees, making sure that you have their trust to let you know what's of a concern to you and your health and safety here on the job. I feel like those are such crucial and important skills in public health. Specifically, I feel like I'll apply those type of skills in public health research. because it's so important to know what it is that the community that you're working with, what are their concerns. It's a lot of community engaged research, which is what I'm passionate about too. It's so important, and I feel like the skills that I've learned through this internship experience set a really well foundation for me to be able to expand on it in the later years.
And that's so important too, right? The internships often, like Ryan, lead to this job, but sometimes they just really solidify for you that you're in the right space, you're on the right path for yourself. Sometimes they tell you you're not. Raising hand, right? And that's okay. That's what the experiences are there for. So it's good either way. So it's really great to hear that for you. And it sounds like for our other panelists today, it's really solidified for you, like the things that excite you and feel that things that you know are going to contribute to public health, and also where you're going to go next. And so that's a really, that affirming feeling is really great. So this is kind of just another general question, and maybe you've already covered it, and that's okay if you have. What was your favorite part of your internship? Just like, what was the favorite, other than the helicopter ride, maybe, like what was the favorite thing that you did or learned, if you haven't already talked about it, if you haven't already kind of covered that?
Graham County has been a great resource to me. I mean, it's pretty incredible. My preceptor, the information that she was able to compile on coalition building, and especially I come from a background in lab work, and so it's very different in public health with how things work, of course, and just being able to have all those resources to read over and learn about. And she connected me to a lot of different coalitions. I was able to sit on meetings, community health workers, which was pulled together actually by a student from that recently graduated from the University of Arizona. So that was really exciting to be able to just learn about all the different ways that coalitions can come together to improve health, and kind of a segue in my transition from lab work to public health.
Yeah, it's really cool, Chad. I'm just sort of listening to you, and like the love you have for the databases, but the love you have for the people. I think that bodes really well for public health career, right? We don't sometimes see both things happening. And so I think that's really exciting for you.
Yeah, very much.
Yeah, that's great. Lizzie, favorite thing?
My favorite thing was working with Jonathan Bell and Dr. Melanie Taylor. They're both absolutely brilliant. Like Dr. Taylor is an expert in all things sexually transmitted diseases, and just being able to work with them, learn from them. It was such a positive, supportive environment, and really made for an awesome internship experience. And I'm super, super grateful for that.
That's great. Were you at the STD clinic, or were you just at the count? You were at the STD clinic. Okay.
Yeah. Oh, I was like upstairs in
Okay.
the epidemiology department, but yeah, I went in every day, and it was awesome. And we still like are finalizing some manuscript stuff, so I still meet with them, and it's great.
That's awesome. That's really exciting. Sam and Ryan, favorite thing?
I think my favorite thing, and I'll kind of piggyback off Lizzie's, my preceptor. So I got to give a shout out to Yara Castro. She has been amazing throughout this whole experience, just guiding me, but also really letting me like take charge of my internship. Like this was my project. I got to interact with all of the leaders from the different agencies and just kind of make the website like my vision. So it's just been amazing just working with her and just working with everyone. And there's also another gentleman that I worked with who has lived experience, and he was able to give me some really good insight on what it's like to go through substance use from that perspective, and how this website can be a useful tool. So just getting all of that experience and information to me has been really awesome.
That is great. Yara, thank you for doing such an amazing job, amazing experience for Ryan. Yeah, the ability to have guidance and also empower you to be able to take ownership is a really important part of the project. We're really happy to hear that. Sam.
For me, my favorite part of the internship was connecting with so many different people, like different occupations, different life stories. As a safety and industrial hygiene, you're trying to build that relationship with them. And there comes at times where you have someone right in front of you telling them how they got to where they're at. And it's just very interesting and exciting to learn where life can take you, like it did for some individuals. So that's pretty exciting.
Yeah, the real people, right? The stories, not just the data. Data's great, but the stories behind the data and the stories behind the people you're meeting, or to Ryan's point, the gentleman she talked to, really that's what public health is, right? It's about people. And that's great to hear that you had some of those moments as well. That's really important. Okay, I'm going to wrap up with one last question before we open it to the audience. And that is, what is some parting advice that you would give to MPH students or prospective students about seeking these experiential opportunities? Just the advice that either you got and you followed and it helped you immensely, or you wish you would have had. One of those two, wherever it lands for you.
I can start. So advice-wise, two things. The first thing that popped up to my head was all the paperwork stuff you have to do to get this internship going. Do not procrastinate. Work with your professors, work with Sam, get all the info you need, and planning your internship. I think being open to all the possibilities and like all the creativity that comes with it, but be strategic. So I'm the type of person where I have an idea and I start making it really, really big. And I had help saying, no, Ryan, you have 225 hours. Let's hone it down to 4 deliverables, some objectives, 1 goal. And for me, that was helpful because I was able to attain what I wanted to do, but I needed that help. And I had to admit, like, okay, I need to ask, because if not, I'm going to be all over the place.
And we're so happy to hear you say that. The support is here, both to get paperwork done early, wink, wink, we paid her for that one, but also to reach out to your professors, to your coordinator, to whoever you need to sometimes scale things back and sometimes scale things up, wherever it is for you. But that advice on how to make it manageable. We want these experiences to be important and significant, but not overwhelmingly beyond what you need to do either. And we have a tendency to do that because we love the work that we're doing. Sam.
I think the biggest advice that I can give, which was something that I followed, was to really follow the course sequencing and the curriculum for the MPH students. If you do that, I promise you can, there's more opportunities, because you don't want to be in a position where you're not able to start your internship because you haven't taken a specific class. So just following that coursework opens the doors to you being able to apply for some positions. I know for me, a lot of the positions in the area that I'm in opened during the summer, and actually completing the coursework by following the sequencing guide allowed me to apply to those internships. I guess you just don't want to be in a position where you're leaving the internship for the last semester, although that's fine if you find something that you like, but you want to open up opportunities and not having to take one just because you have to.
It's better to be able to say no than it is to not have the option. Thank you, Sam. That's really important. Yes, thank you, Ryan. Yeah, one thing I think we'll point out is there's some sequencing differences between online programs and campus and Phoenix programs. So one is more prescriptive and the other has more flexibility. When you have that flexibility, be careful with how you use it, right? To make sure that you are in a position to seek internships at the time when you want to be able to find them is really helpful. Lizzie.
I would say my piece of advice, and I'm sure everyone here is already a self-starter, but to be one and make sure that, I think just keep in the back of your mind that the preceptors you're working with have full-time jobs that don't pay them to have an internship student and take you on. And they're doing that out of the goodness of their love for public health and love for teaching. And so really obviously ask them questions, reach out to them, collaborate with them, but set up, especially all the paperwork, like set it up for them to just be able to fill it out, do it, be done, and make their lives as easy as possible. And just try and be as helpful as you possibly can during the internship.
That's really great point. Yes, they all have full-time jobs. And so we love them and we adore them, but making things straightforward and simple, check-in meetings, those sorts of things are really, really important for you and for the agency. Chad.
My advice, I guess it kind of goes along with what you all are saying, I think, too, but don't be afraid to take charge of your own projects and propose your own ideas, especially in this MPH program. You're a master's student now, you're kind of a professional. And so being able to take charge on projects or even just suggest ideas to the group. Sometimes everyone has stupid ideas that they regret later, or maybe weren't quite thought out as well as you would have liked. But public health seems to be, maybe I've been really lucky, but it seems to be all about collaboration. And I've had a great group that like will be able to kind of guide me in the right direction. Or if I have a bad idea, they'll be like, oh, maybe we should do this instead. Like they won't let you fall. So it's the internship in particular is a great time to kind of figure yourself out and try out some of your own ideas too. And hopefully your team of collaborators will help you avoid pitfalls along the way.
Yeah, I love that. Embrace being the professional that you are and really showcase the skills and knowledge you've learned while being open and flexible to learning in that environment. That's fantastic. Well, thank you. Those are the prepared questions. So we have about 10 minutes. We want to open it to the audience. If folks have questions, you can use the chat or you can raise your hand, please, and we'll call on you for questions. Oh, Anthony, you have a question. Yes.
Yeah, I'll say, I think for Lizzie, you had mentioned that you got your manuscript published. And I was kind of curious, was that your first time getting something published? And if so, how was that process?
Yeah, thanks for that question. It was my first authorship publication. I'd previously published in undergrad, but I felt like in undergrad, it was supposed to be my first author publication, and then it got swiped from me by a PhD student. So this was a much better experience. And I really leaned on Jonathan and Dr. Taylor, my preceptors, because I have like a general sense of how to write a manuscript, how to write a research paper, but what they really helped me with is guiding me through like the specific journal requirements, making sure I met all the requirements that they have, like getting it under word count, because I tend to be a little wordy. It was overall a really, really great experience. And especially when you get the revisions back from the reviewers, it feels like they hated it, they're going to reject it. It's a terrible time, but walking through all those and being able to defend them was a really gratifying experience because I'd done all the work to that point and knew that what we were publishing was really important. And they were just trying to poke holes for like really important reasons. So I think overall it was a really meaningful experience and something that like you never really get trained on in school when we're all going into fields that can lend itself to manuscripts and research publications. So having mentors that help you through it is really unique and important.
Trial by fire. I saw some faculty nodding like, yep, that's what happens. That's really exciting. Is that one of your deliverables for your internship project? Yes, excellent. That is excellent. I was going to say it should be, if it wasn't already going to be. Great. Well, seeing no other questions, we'll still be here until 5 o'clock, but I'm going to first of all say thank you, Lizzie, Chad, Ryan, and Sam. Thank you so much. This is amazing to hear about your projects. Samantha from our office is going to tell folks how to access the internship presentation. So make sure you go and watch minimally Lizzie, Chad, Ryan, and Sam, so you can see kind of the whole presentation about what they did. I think you'll have some great context if you haven't already watched it. But I'm going to pass it to Samantha, and she's going to give some more information about our virtual presentations.
Yes, hi everyone, and thank you so much everyone for attending today's virtual internship conference. Very excited for all 4 of you. I learned a lot. I get super fired up after these events when I learn of all of the great things that our public health students are doing. So like Kim mentioned, I'm going to do a little bit of a discussion regarding what the conference is and then talking about the website. So I'm going to be talking in pieces here. So first off, thank you everyone for attending today, and thank you Kim and all of our presenters for this discussion. First, we would like to thank all of our wonderful internship sites throughout the state, nation, and world with whom we work to improve the state of public health. The Internship Conference serves as a professional opportunity for our Master of Public Health students to share their applied practice experiences and has been one of the most impactful and practical components of the program's curriculum. Hearing all of their presentations, hearing all of what they've worked on, that goes without saying. Since its establishment, the MPH Internship Conference has grown in stature and significance, and the college uses this event as a public health networking tool by inviting public health practitioners, partners, and alumni throughout the state. The key to its success lies in the student participation in this panel and the exceptional student presentation. So thank you all again. Through contributions they have made and the benefits they have gained, the Internship Conference reflects the handprint of MESCOP students on public health projects and agencies throughout the world. We sincerely thank you for coming to our virtual Internship Conference highlight event. And for those of you viewing this recording, hello and thank you for watching. There's a link to a feedback form for this live event, and we will now post it in the chat. We would appreciate if you could take a few minutes to complete the form and help us make this event better each time that we host it. And thank you, Kim, for putting it in the chat. So that is about the Internship Conference itself. I now want to chat a little bit about the website where you're going to see all of our students across all of our different campuses presentations. So the virtual experience allows us to provide an internship conference that showcases projects from students across all of our campuses. Each student has recorded themselves presenting on their master's internship experience. These presentation recordings are being hosted on a webpage on the College of Public Health website. The webpage went live on Monday, and you can now access our Spring 23 presenters presentation recordings. And thank you, Kim, for putting that in the chat. We have also sent this website link to all of our College of Public Health community, as well as individually to all of our presenters for them to share with family, friends, site preceptors, and anyone else they would like to share this with. Presentations will be viewable and on demand starting on Monday up until May 5th. We have now come to the end of our live event. We sincerely appreciate all of you joining us this afternoon, and thank you to all of our student panelists and Kim for moderating. We hope you enjoy watching our student presentation. And again, if you're recording this or watching the recording of this, thank you so much. And we all wish you a great day.